Good morning, good afternoon, and good evening, everyone. And thanks for joining us today for this session on localized anticipatory action, Panacea and Pitfalls. So today's webinar is being presented by the Academic Alliance for Anticipatory Action, also known as the 4As. I'm sure many of you have come across them, especially when you're working in the anticipatory action space. It's a consortium of 7 universities in the US, Africa, and Asia, and it's funded by the USAID. The goal of 4As as a consortium is to increase knowledge, with a knowledge base on what works in anticipatory action, where, for whom, and how, and when. So on the note of introduction, I'll briefly introduce the session and then myself and the panelists. So as many of you working in the anticipatory action space will know, anticipatory action has gained quite a bit of traction in the past few years. And with that, also the interest in localized anticipatory action. So because anticipatory action depends so much on timeliness and providing timely information and timely intervention, so that finding that right window of opportunity, there is growing recognition that local actors, as the first responders, typically in humanitarian crises, are key in this space, and that we need to capitalize more on partnerships with them, working together with them to provide timely early warnings and interventions. I don't know how many of you saw the Anticipation Hub's 2022 Anticipatory Action Report, so the State of the Sector report, but in it they do state that there's a growing number of locally led anticipatory action initiatives where local actors act ahead of time or ahead of forecasted hazards using either localized funding based on local forecasts, local knowledge, actions, and approaches. But it's really hard to capture these undertakings and these efforts. And so in today's webinar, we'll hear from researchers and practitioners and local voices about the merits and challenges, and as well as drawing and practical examples of localized anticipatory action. My name is Njambi-Szlapka. I'm a PhD researcher at the University of Edinburgh's Global Academy of Agriculture and Food Systems, which is supported by the Jim Mill Observatory for Food Security and Early Action. I'm joined today by 3 great panelists from different backgrounds, ranging from research, practice, and to a certain extent, advocacy. So I'm just going to go ahead and introduce them now. So our first presenter would be Artur. Luis is an associate professor at Eduardo Mondlane University, I hope I pronounced that correctly, at the Faculty of Agronomy and Forestry Engineering. He holds a PhD in Sociology of Disasters and Climate Change from Wageningen University in the Netherlands. And as a researcher, Luis has been involved in several projects, including with the Academic Alliance for Anticipatory Action, 4As, as well as CoLocal, which stands for Co-Creating Knowledge and Climate Change with Local Communities, various forecast-based financing projects, as well as the REPRISA, which is the Resilience and Preparedness for Tropical Cyclones in Southern Africa. Luis is also currently the coordinator of the master's course in climate change and agrarian systems and the leader of the team that is designing the Center for Disaster Studies and Climate Resilience at UAM. Welcome, Luis. Our second presenter is Dr. Easton-Calabria, who is a senior researcher at the Feinstein International Center at Tufts University and a research associate at the Refugee Studies Center at the University of Oxford. She works at the intersection of climate, conflict, and vulnerable populations with a focus on anticipatory action and displaced people. Evan has led major research projects in humanitarian development programming for protracted and multiple crises, sorry, that's a mouthful, with a focus on livelihoods and self-reliance for displaced populations in Eastern and the Horn of Africa. This has included projects examining OCHA-facilitated anticipatory action pilots through her work as part of the 4As. Welcome, Evan.
Thank you all. Great to be here. Back over to you, Susan.
Excellent. And finally, we're also joined by Samuel Munyuwiny. Samuel is a passionate advocate for locally driven initiatives in development and humanitarian work with expertise in development studies, public health, human rights, and knowledge management. He co-founded the African Institute for Children's Studies in 2009, which is a Pan-African organization focused on child rights. Samuel also played a pivotal role in the Consortium for Reimagining Humanitarian Action, CRHA, offering technical support to enhance the involvement of local organizations in development and humanitarian efforts across Eastern and Southern Africa. He has authored and co-authored several published research pieces focusing on anticipatory measures against child hunger associated with climate change, extreme weather patterns, and engagement of nomadic communities. Welcome, Samuel.
Thank you, Susan. Pleasure to be here. Thank you.
Excellent. Welcome to the panelists, and thanks all again for those who have joined today. So the format of this webinar is, so we won't necessarily be having presentations as such. We've organized this as a sort of conversation with some key questions around what we understand by localized anticipatory action, how it looks like, why we should care about it, and how we move forward from this. So we will have at the start sort of this conversation with the panelists, and at the end we have about 20 minutes where you, the audience, can ask questions directly to the panelists. So do keep those coming in the Q&A as and when they pop into your head, and then we will bring this up towards that in that section. So just to get us started and sort of set the groundwork for what it is that we're talking about, I'd like to start with the first question, which is about what it is that we actually mean with localized anticipatory action. I'm going to turn over to you, Luis. What does this expression mean to you? What is it? What are we talking about? Thanks, Luis.
Thanks, Susan. Well, I think it's a $1 million question, because as anticipatory action is a new field, and all of us were trying to figure out what it really means, whether theoretically or in practice, actually. But I think we can borrow back to when we talk about anticipatory action, localization agenda. It brings me back to early 80s when a very bright guy called Robert Chambers from England, he wrote a nice book called Putting the Last First, which by that he means that we have to reverse the way we are working with local communities, putting locals at the front line instead of looking at them as beneficiaries at the end of the spectrum. So that brought to the development arena a different way of doing development, but also it went into the humanitarian world as well. Obviously, by the time on the 80s and the 90s, the humanitarian was very militarized somehow, was really top down, very difficult to do humanitarian putting the last first, because the assumption by that time was, these really need order. You have to evacuate people, no participation on whatever it is needed on humanitarian setting. So, but you look back 20, 30 years ago, people already speaking of or demanding that local actors should be at the driving seat, and they're having a say in the process of designing, prioritizing, implementing, monitoring, evaluating interventions, aid for development, for humanitarian, and now finally, very recently, also on anticipatory action. So the idea, on my perspective, is when we are designing anticipatory action, which are actions that have to take place before disaster, that those actions should be led and have a huge engagement, not theoretically, but in practical ways, local peoples and local actors. You mean it, local society, civil society, public and private actors that are present and at the front line of disaster response or disaster anticipatory actions. I think I start from here. Thank you.
Thanks, Luis. That's very helpful. Yeah, not seeing local communities just as beneficiaries, but as active participants in the process. If I can turn over to Samuel, what does this mean to you in your work?
Thank you, Susan. I really want to build on what Prof. Louis has mentioned, and I think it really goes beyond just saying we put them in front. For me, I think it's about having dignity. That ultimately, when you interact with human beings, especially those in special need, humanitarian situations, anytime, can be really remove all the sense of who you are, the sense of respect that you are in. And whenever I've interacted with communities in an attempt to support them, I think the most significant thing that you leave them with is a sense of dignity. And that sense of dignity is in appreciating that it's not many times, not the first time the communities will be going through a struggle. And that when you go back there, building on their own knowledge is part of really what gives them a sense of dignity. It's also very critical that when you go into communities, you do not assume that the institutions that are there completely have no knowledge of what they're supposed to do. I think, unfortunately, many times when response has been done, whenever the humanitarian crisis is, that like there are no institutions, and we come in and create new institutions and completely forget what was there. So I see those as critical, but also very important is getting these voices of the local community members to be integrated in a global space. We appreciate that decision-making eventually happens a lot at a global space. And where these knowledge, these voices of the community aren't integrated in that then becomes quite a challenge. Like you mentioned in my introduction, I work in a nonprofit space, which we started so that we can enable people from Africa to be able to be at the lead in trying to solve problems as African Institute for Children Studies. But unfortunately, even when you look at the funding mechanisms, when you go into sharing of the knowledge, the publications that are done, there's a very limited space that is provided for the locals to be able to have their voices there. Maybe I could leave it at that, and then we can build a conversation.
Perfect. Thanks so much, Samuel. A lot to chew on there, ranging from sort of what are the institutional mechanisms that are allowing that, the assumptions we make about pre-existing knowledge at the local level, certainly points we will come back to. I'll go now to Evan, and if you can tell us a little bit what the term means to you in your line of work.
Great. Yeah, and thank you to the other panelists. I always keep pens and notepads. I've been scribbling notes already. I thought I would kind of switch it up because I'd say I think about localization a lot. And this past year, kind of year and a half, I've been doing more projects where I've been trying to kind of challenge myself around the notion of it. And I'd say I first entered into the localization kind of space, as it were, through my work with refugees and really feeling like refugee-led organizations weren't being recognized as local actors. And that often when in the humanitarian space, localization was talked about, it actually still felt like it was stopping at the national level, that somehow local meant not international, which I found very problematic. And then I've had the opportunity to work with some organizations and better understand kind of different UN agencies and better understand their kind of processes around anticipatory action. And that ranges from, between UN agencies and then also looking at, the headquarters of agencies to the country offices to the subnational offices. And I started to think about how a lot of the different conversations I was having, sometimes just internally, were mirroring the other work I'd done around localization, and thinking that there was actually this whole kind of world of the local happening within international organizations. So I'd say I'm here as kind of a counterpoint of sorts. I've written an article. I'm working through this concept that I'd love suggestions on the name, but I call it internal localization, of really saying we need to be looking at international organizations as much more beyond this binary of like local versus international. I don't think that exists. And a lot of the conversations I've had with different UN actors from, who are nationals of the country they're working in, ranging to, more of the expats we sometimes speak of as well, that there's issues that sometimes have to do with power, but sometimes just have to do with geography. So a lot of conversations I had are people saying, actually, at the country office, we felt like we didn't have a good enough grasp of what was happening at the subnational office. And, people said that there was flooding, but somehow that the information didn't come through, or there was challenges around understanding what preparation had been done. And all of this has huge ramifications, right, as one can imagine, for anticipatory action in terms of just the communication that's happening. And so I'd say we can think about localization within organizations of not just nationalities, which is actually a really important part of work around, equality and representation, that, there's more that can be done within, but then the geographical aspect of just where are offices that are really the ones that have to pre-position the goods, where are they, obviously located in a country, but where are those conversations and flows of decision-making also happening within a country? And sometimes it seems quite localized at the country office and centralized at the country office level in ways that don't enable kind of local actions from just an officer in the quote field to really help make sure the dikes are being built, for example, in advance of a flooding. So I'll pause there and look forward to the conversation.
Perfect. Thanks, Evan. So the call from Evan there to look at it with a little bit more nuance and add a little bit more sort of spice to the conversation that goes beyond that simple binary between local and non-local. So having sort of defined what it is that we're talking about in broad terms, let's get to basically essentially how we do this. So the global network of CSOs for disaster risk reduction was reporting this year that about 84% of local actors are actually not included even in assessing risks or threats or preparing plans or taking action against the risks and hazards that we are trying to preempt and anticipate, despite the fact that we are seeing a growth of the debate around, as well as support for localized anticipatory action. So they suggest that we still have a long way to go, but why should we really be caring about localized anticipatory action? What is it really good for, and why? I'm going to start with Samuel this time. If you can tell us a little bit from your own experience of using some of the examples of the work that's been done around localized anticipatory action. Thanks.
Thank you, Susan. Well, I think the loudest of this affirmation that the locals must be at the front line was with COVID. It became very obvious that you are not going to respond effectively because then you're tied on how far you can go. And in terms of anticipation, because then how are we prepared to be able to respond before the disaster happens? That, of course, raised the red flag pretty well. You mentioned in my introduction that some of the research that we conducted is, for example, matters such as child hunger, and especially in the north parts of Eastern Africa and the Horn of Africa, we've seen that whenever there is drought or floods in Kenya, for example, and a large part of even Ethiopia in the recent past, we've had, quite a drastic shift from severe drought to severe flooding. And you ask yourself, were communities able to prepare, anticipate, and be able to respond to that? So the impact on these communities is great. I know sometimes it's become almost just an academic conversation into who did not do what on climate change, but the persons who feel the most any impact of this kind of disasters is the community itself. And like I said earlier on, that many times it's not the first time. In our consortium for imagining humanitarian action, one of the feedback I've received is in the northern eastern region of Kenya, for example, they've known that there are patterns that birds fly, and they will tell you how severe a drought will be. That will enable the elders to be able to start working together and be able to engage on conversation on water sharing. And we know how sharing of water resources has led to a lot more conflict within communities. And therefore, what I'm saying is, it is very critical that communities become the first mechanisms for preparation, because the first circle of protection of any human being is themselves and then the communities around them. And going with that is also that if you're going to do anything in a sustainable manner, then it will have to take the community being able to stay on. Let me give you a quick example of some of the observations that I've learned. Let me use the example of HIV, because I've done some evaluation of HIV programming. And we noticed that organizations that were very small, so to say 15 years ago, and couldn't manage grants of even $20,000, are now managing huge grants. They're able to work better with their own community groups and be able to respond better in terms of HIV management and the challenges that come with it. So it is important that if you're going to build community structures that can respond in a very sustainable way, then definitely you need the locals. I like what Ivan mentioned earlier on. What we've seen with the current dynamics, the global policy change around, investing more in local interventions, is unfortunately that the international organizations quickly registered as local organizations, and they're able to tap into these resources. And then you're asking yourself, so if we keep blaming the local organizations in terms of their limited capacity to manage either some resources, they don't have the institutional structures, and you bring in the big organization because it has that, at what point do we expect to build these very sustainable structures of those who are truly in the communities, being able to respond to that? So I see those as some of the areas that have remained quite a challenge. Given, or granted, we've made some good progress, I must say. There's more listening on that space, but I think the power dynamics really still play on. Thank you, Susan.
Great, thanks, Samuel. That lots of food for thoughts there, and also great to draw those examples from COVID, HIV. So it's a lot of these discussions probably would have been had in other topics, but we don't do a great job of drawing from other areas of work. So it's really great to see that, to see those examples being brought in there. I'm going to move over to Evan and maybe providing that broader perspective. What's localized anticipatory action good for? There is a question in the chat from Ale Batchev. Sorry if I'm mispronouncing your name. I don't know if any of you wanted to come in on that, but yeah, let me move over to Evan.
Okay, I can't actually see the question in the chat. I'll scroll, I can't multitask. Great, well, Samuel is speaking my language, as I'm sure he is with many of us, or most all of us. Do you know, I think for this question, my answer is kind of hypothetical, which I think is, sometimes problematic as a researcher to speak in that, but I really do often draw on my work with refugee-led organizations, and I haven't done, work related to anticipatory action with these organizations because, as far as I know, there haven't been interventions that have brought in organizations that refugees themselves have led, and I would love to be corrected. So please do write in the chat or interrupt me if that's not the case. But the work that I've done has been in Uganda and Kenya with refugee-led organizations, and with one organization in particular I've worked with for 12 years. And they're located in Kampala, in sort of an informal settlement area. And when I think about what, a flood in that part of Kampala might mean, it would mean, frankly, kind of devastation of homes. It would have huge impacts, obviously, for all the reasons that come to mind for us of disease and, lack of access to drinking water and so on. And then when I think about the role that they could play in addressing some of this and in spreading the word for, early warnings, it's quite profound, because when we think of these small organizations, as Samuel mentioned, and I'll just keep my example of refugees, it's refugees that are able to access people that organizations can't access, and either because they don't know about them, because those people have chosen never to register with a formal agency, or they're too scared to. Some of the people I know are literally in hiding because they're still being persecuted from the Democratic Republic of Congo. But these organizations are a safe place for them. So there's knowledge of people in a community that they could go and warn, or they could deliver supplies to, that no giant humanitarian agency would ever be able to reach. And thinking about the specialized needs as well, of kind of going into that, of knowing quite quickly what those particular needs might be. So refugees as a very marginalized population, not especially, but including in urban areas where they're often not legally recognized and not necessarily allowed to be there. There's a huge knowledge that refugees themselves have of what a flood might mean, or a drought might mean for this group, that broader agencies that are working on broader industry action interventions just might not know to look for specifically unless there is a targeted intervention. So those are some of the pieces that came to mind. And I guess the other one is, going off what Samuel said, it's exactly, that's what we saw in the refugee space with COVID as well, that, the other agencies left, and it was refugee-led organizations that were passing out the masks and, were delivering the food aid when, in Kampala, there was complete lockdown. and no food was provided to refugees by the government. So we really saw organizations stepping in, and I'd say that's exactly what we would see in the case of a disaster. On one hand, because those people would still be there, they would not be, have the luxury to leave. Speaking of kind of the problematics of the humanitarian sphere, but also because they would want to be helping and, in furthering their own work and kind of the work that they're doing day to day for communities, regardless of the type of disaster that people are facing. I'll close there.
Great. Thank you, Evan, and lots of food for thought there again. I'm just trying to monitor the chat. Yeah, I think it's really great to also bring sort of those differentiation between different communities, because not necessarily all communities face the same needs. So I think it's great to be able to speak to, the needs of refugees and how the types of organizations that have continuous access to them and understand the specialized needs might be better place to actually respond to those needs. And there's a discussion going on a little bit in the chat about whether this is very specific to anticipatory action or whether this is just quite universally applicable, which I think is something we can come back to. But from where I stand, I think we tend to speak about this more in anticipatory action because of the time constraints that we have, right? And then the need to really respond quite quickly. I'm going to move over to Luis with the same question. So in your experience, what is localized anticipatory action good for? Why?
There are different reasons why people do localization. Some of them very discussed already, and issues of legitimacy, when you're involving in the local actors are in front line, so you have more legitimacy on interventions, more efficiency, more sustainability issues. All those things have come to mean that localization of anticipatory action is a way forward on humanitarian. But obviously, there are different, that's why why we are discussing Panacea and pitfalls of local-led processes, because communities are not homogeneous. There are power dynamics and power issues also within the communities. And just to give an example of what happened, when we're implementing a project of linking climate change adaptation to social protection, we started discussion with the people that would be, we call it the participants, not the beneficiaries, because all of us who are engaged in the project, we are all of us beneficiaries of an intervention, whether it's a consultant, whether as a humanitarian worker, etc. But at the community level, there were different views of the interventions. The gatekeepers or the local elites, for instance, they were more in favor of livestock, but livestock like cows, the big animals. But when we started to discuss with the most vulnerable people, their needs were completely different. We don't have the capacity to manage cows. Rather, we would go into chicken and small poultry. So it means when you're talking about the localization issues, you have to make sure and obviously take into consideration that are different layers of power dynamics, power relation, different needs and different priorities within the communities. And that brings us to issues of whether this is a panacea, and because there are a lot of pitfalls within when we're trying to advance the issues of local-led process. But if it is well done, I think local-led process, they are good for nearly everything, okay? Sustainability, efficiency, efficacy, but it has to be well done. And it's not easy to be well done, because different interests, it's the battlefield of intervention, because different interests are boiled into. Just for instance, when Evans was explaining this relationship between the locals and international, whether you have this distinction between locals and international, is already an issue of contentious, okay? If you assume that there are no really difference between, no cross-cutting line between international and locals, are we advocating for reinforcing the existing power dynamics and power relation between locals and internationals, or we are advocating that the international could somehow turn into locals, as Samuel was just saying a few minutes ago. So we have to distill it a bit deeper, what it means really to be local, what is the local-led process, and what's to be international, but also local, because a lot of, as Evans was explaining, there are a lot of people who prefer to work with international organizations because they feel more comfort, they're more open to discuss issues rather than locals for different reasons. Over.
Great, thanks, Luis. Again, a call there to be a little bit more differentiated in the discussion, to make sure we're not reinforcing pre-existing power dynamics, by calling things a certain way, and really understanding that not all people have the same needs just because they're referred to as local or national. So those are some really great pointers there that nuance our discussion around this a bit more. I'm going to move on to the third question, which would be the last one before we move over to the questions from the audience. And the third question really is looking forward into the future. Where do we go from here? Evan, can I start with you?
Great. Well, I'd say picking up the strands of this concept of internal localization and some of what Luis also said, I think there's a real need to be more introspective as international organizations, right? Whatever that means. But that idea of looking more critically that, when we're talking about COVID, who evacuated, who didn't, these are not international organizations, right? And we think about Gaza and who has stayed in Gaza and so on. Like, there's kind of terrible outcomes in situations when people don't have the possibility to leave, or when nationality becomes a barrier that it hasn't before, and it's been quite useful to have kind of nationals and so on. So I think there is a real need, and there's some real powerful work that's happened, I'd say, in the last 5 years, that's looking at the racism in the humanitarian sector and so on. And so even if that's not particular to anticipatory action, because it goes so much wider, it also is important for anticipatory action in terms of, again, some of what I found was communication delays, that people were saying, I felt like I didn't have the power to make this decision. And other people were saying, well, of course they did. That's strange. And so that's interesting, right? If we start to think about, well, was that based on nationality? Was that based on the location of, right, who was in which subnational versus country office? Those are all elements that have to do with this concept of the local. So I'd say a real need for more critical introspection and maybe naming it, whatever that is, if it feels like that's, issues of racism, or it's issues of, kind of not enough communication, right? Not enough emails being sent, or too many emails being sent. I think there's a lot to look at there. And then I would also say that a study I did, or I was part of during COVID, that was looking at how Red Cross national societies had to make adjustments to their early action, their EAPs, their early action protocols, because of COVID, shed really interesting light on localization. So we didn't set out to understand kind of localization as a topic, but what emerged were national societies, which are, kind of local actors, national actors, part of the international network. So an interesting example that really felt like there needed to be more flexibility with funding. And that's something that I think we do hear, again, beyond the anticipatory action space, but it was really concentrated in these national societies that did activate during COVID and had spent sometimes years developing, very, very thorough planning, the pre-positioning, the pre-financing, everything was in place. And suddenly the evacuation shelters couldn't be filled to capacity, and they had to find other options, or the cooling buses, could only be filled to a third in order to meet COVID guidelines. And that had, huge ramifications for the ability to undertake operations. And because there was such kind of strictness in terms of these protocols, sometimes that wasn't possible. And that made, or there were just huge challenges in making it possible. And so a lot of what we ended up hearing were these societies saying, wait a second, we should have more decision-making power, right? Like, these are the examples of the very times when we need to be able to be more adaptable. And, we spent 2 years planning this, the situation is different, and now kind of our hands are tied. So that, I think, is not unique to the Red Cross movement and to FBF and all of that. I think that's an important ongoing call for looking at flexibility within industry action and seeing how that both is kind of.
Evan, I'm going to have to ask you to wrap, just so we leave enough time for the audience as well.
I made you promise you would interrupt me. Yes, just to say that that's linked to local actors having decision-making power, that notion of flexibility. Thank you.
Great, thank you. Yeah, definitely the issue around flexibility, and I think Samuel, you also talked a little bit about it when it comes to funding, is something that's come up with a lot of organizations as well. Right, so I'm gonna just a moment. So I'm gonna go now to Samuel and to ask you to talk a little bit about what you see, envision for the future, where we go from here.
Susan, and as I do that, I'm following the chat, and I think they're very legit questions being asked here. Are we talking about localized anticipatory humanitarian actions or localized anticipatory action? I want to believe, is it Momo, is asking this from the point, is this applicable only humanitarian? Are we talking too much just about humanitarian? And then there was also a concern that can we bring in more actions pre-disaster rather than post-disaster? And I think those are very valid. So one, I think this webinar was also designed to look at more from a disaster point. Are we disaster ready? And of course, a lot of anticipatory processes and requirements from a public health point are really required where you have very unpredictable situations. We still do need a lot of localization in a development space, but they're really very critical when it comes to unanticipated, things that we did not expect at all. Now, I've done some community projects where we prepare the community. In part of Western Kenya is very prone to floods. And one of the things we did in that community was to create what are called nyumba kumis. This was before even the government of Kenya took it up as a strategy in ensuring that no one is left behind. So I think it is very critical that we can take count of everybody in a community, especially those with, like persons with disability or the elderly. Sometimes the structures that exist that, bring in an accountability mechanism for everyone often do not take, care of the needs of those who are most vulnerable. And I think the beginning point is that. So when you did our nyumba kumi, which means 10 households, so it means for every 10 households, you had one person who was responsible for it. We were able to map out and take care of every child, every adult, the elderly, and be able to find a mechanism in which we provide them back. So that to me is a very critical beginning point. Secondly is the local organizations for sure are important vehicles that you want to continue investing in, not just because you want to prepare them to receive funding or to be the ones to implement, but I believe from a rights-based point that governments must take responsibility. And we have seen situations where there's a challenge, especially disasters, and governments actually become the barriers to access to services for populations. And therefore, the only people who can unlock that is many times the local communities, because then they have power to the ballot, and where ballots don't count much, they still have the relations and the connections that exist. So I see the importance of being very deliberate that if we're going to prepare communities to respond to any challenge or to be engaged better in development, then we must invest in this over a long period of time. And this means you do not need to have these 6-month grants or those kind of short projects that don't leave any power to the people eventually. I think we must be prepared to work with a group for a long period. And that's why I gave the example of the HIV space. And lastly, I did mention the advocacy component, very critical whenever there's a Davos meeting. Do we really have space for voices that come with evidence-informed interventions? Thank you.
Great, thanks, Samuel. Really important point there. Do we have the right voices in the important rooms as well, right? How many of these organizations do we actually see represented in, those big decision-making platforms like Davos? I'm going to move over to Luis, and to you the same question, Luis. There's also a question in the chat that I think ties in nicely here when we're talking about that question on moving forward, which is about how we make this more sustainable. Sorry to put you on the spot there, Luis.
Thank you. Well, I think a lot of participants are here because they are, and this the are working on in the area of anticipatory action, and the anticipatory action depends heavily first on the early warning systems functioning. And what it suggests under localized anticipatory action is, okay, what's going on with the early warning system? What is the role of local community, local actors in providing effective knowledge, effective information in the early warning system? There are some circumstances that local knowledge may be very relevant, obviously not all within the limits of their knowledge and information. We have to be very careful when we speak about engaging local communities. As everyone else, they have also their limitations in terms of knowledge, in terms of capabilities. So not always what is there is useful for themselves even, okay? Because they have also limitations. But in any way, as the anticipatory action depends on the early warning system, it's obviously very important to know what kind of a system of early warning system are out there at the community, and how useful they could be in designing anticipatory action intervention. And then you need anticipatory action plans. So based on early warning, on information, you have a plan that you can implement before a disaster strikes. And that plan should really be informed by the local priorities, etc. Obviously, there are all those issues that are already mentioned. Was action is part of the plan? Is it from the really very vulnerable, or like local elites are capturing the intervention as well? It could be during the planning, during the implementation, etc. And the funding mechanisms are very relevant. Obviously, this is the handicap that local community, local actors do have. They may have information, may have ideas of what they could be done before this disaster strikes, but may be lacking finance to do that. Here also we have to be very careful. I have come across a discourse that had been developed by local communities because they know they have to say we have nothing so that they can have access to resources. You mean it, any kind of resources. So sometimes there are a lot of resources. I'm gonna give you one example. During COVID-19, I was leading a program of intervention for COVID-19. And a lot of NGOs and other actors were distributing masks, soaps, etc. We did it other way around. Went to look what capacity out there of producing by themselves masks. So instead of bringing into community masks, we provide them sewing machines so that they could make the mask by themselves, okay? Expense that they have in making soaps. And they explained to people that made soap in the past and what kind of ingredients that we could build from there. So those kind of resources may be available at local level. And that could make the process more sustainable, just capturing from what was asked for. So the sewing machine that we left in 2019, 2020, they are still now working to make clothes for local kids to go to school, uniforms, etc. So those kind of changing the mindset, how we make our interventions, looking what capacity are out there, and how can we build from the local, those capacities Samuel also and Evans mentioned. Over.
Great, thanks, Luis, and also thanks for going into that question. I like the way you sort of took the sustainability question, almost embedded that within the localized anticipatory action, actually saying by making it more locally grounded, it actually becomes more sustainable, which I think is probably something that would apply to a lot of other issues, as Evan and Samuel had also asked, who actually stays when you have the crisis. I'm going to turn over to the questions in the chat, and I think there is I feel a bit of nervousness from people saying, actually, we need concrete examples. I'm going to push the panelists to maybe provide examples from your line of work on local actions that were done before a disaster strikes. Concrete examples maybe on how this localized approach was, how it performed with respect to gender and inclusion. I don't know if you have any examples you could provide our audience with.
I can be short because I'll leave it to Samuel and Luis to provide better concrete examples. But Christopher, I really appreciate what you shared around, what does inclusion mean, and asking for those more concrete. I've recently been reading more about the gender aspect of anticipatory action, and I'll share just one piece you may have come across that's looking at GBV and anticipatory action and so on. But overall, the research is quite thin in terms of that focus of women and girls in particular. And I'd say that there's, some are saying AA is quite gender blind, and that actually we really need to do a lot more work to understand that. So I just wanted to kind of share that because that's been kind of an emerging topic for me. I do know that UNFPA is starting to develop an interaction mechanism for women and girls specifically. UNICEF has a dedicated AA person. They're starting to do more, child-focused AA. So I think some of the actors that have a real potential to move us further in this space are kind of getting more and more on board.
Great, thanks, Evan. Yeah, well, Luis, were you trying to come in, or?
Yeah, I want to jump in. I think Samuel will bring a lot of local evidence on how this works. And just a few examples of what I have come across. And in 2019, Mozambique was heavily affected by cyclone Idai, which destroyed nearly 90% of the Beira city, the second major city in Mozambique. And overall, the impact was around $3 billion somehow. When all of us went to see how the early warning system really worked so that people could take anticipatory actions. It came across during our evaluation that women did have information, but from second sources. So we're not really getting the information from the radio or from TV, but rather they're having information coming from their husband, from local leaders that are getting information from the first sources, okay? So it means that you're having gender issues on early warning system that have to be accounted for when you're designing these early warning systems, not assume that everybody is getting information the same way. And obviously, women were already overburdened by different issues. They have to take care of the house before they're evacuating, okay? They have to make sure that they're carrying with them the first food that they have to feed their kids when they're evacuating. And have to make sure that the kids that are taking, they're going to a safe place. And all those elements on early warning and the early evacuation meant that women had very much difficulty in moving. So staying behind to make sure that you're saving your belongings, their food, their kids, was really very important for them. So they're getting information very late because they're getting from second sources. And because they have to take care of kids and food, etc., and making sure that they're going to a safer place, they're being left behind of the response to Idai. Those kind of examples were coming from looking at the issues of anticipatory action and early warning systems.
Absolutely. And I think, in my time at Start Network, we did do some studies around this. And I think what emerged really is the need to even just understand risk from a gender perspective. And that already suggests very different windows at which you have to intervene for different groups. So I think that's exactly what you're pointing to, Luis. Samuel, I believe you were trying to come in earlier as well.
Yeah, I wish I could share my screen and just show something as a map, because I think in enabling communities or preparing them to be able to respond, one is information, two is other institutions. So one of the things we've done since 2015, we created a network of local organizations, and we have a web map, including contacts. So if you search, I can put it here. I'll put it on the chat box so that anyone can search for that. Specific to children, we did create what is called the Children Agenda Forum, and in it we have placed contacts of who, for example, will provide response to sexual violence, and who has safe shelters, so I think getting this information visible and known to especially the service providers is critical. I've also seen that in 2015, we did this because at that point we were trying to prepare the civil society groups to engage in the SDG conversation, the post-MDGs. We created WhatsApp groups, And these WhatsApp groups have been very critical. We have currently about over 300 people, practitioners from different government, and I've seen that this has really worked very well, that whenever there's a crisis and you post it there and you need a quick response, we saw it in the post-election, the skirmishes that came up, it was very easy to respond and address the various needs of children. I'm speaking to my children because I spend a lot of my space on that. So I think creating this institution using social media that now exists as a platform to share information and to respond in case management are very practical things that it can work out. Thank you, Susan.
Perfect, great, thanks.
Susan,
Thanks,
just a moment. If you allowed me, we've also seen the potential in replicating this beyond just the country. So I and Louis are part of the Consortium for Emerging Humanitarian Action, and we are building on similar success, building pillars on knowledge management and building community structures that are able to respond and to anticipate.
Perfect, great. Thanks so much for sharing that, Samuel. And yeah, thanks also for sharing the link. And I think if there's a link also to the one that you just mentioned, that would be great. I'm going to move over to another question that we had, which I think is a really great question around measuring success. How do we know when we're doing localized anticipatory action well? I believe was the question in the chat. How do we measure success in this? Or what are some of the criteria factors that lead to successful localized anticipatory action? I hope I captured your question correctly.
I'll be quick and just with the probably very unhelpful response, but thinking, well, how are we defining the local? Like if we start to define the local as organizations, that gets us farther. And I think that's where, I know there was a comment about moving away from the theory, but that's where I think concepts are really useful in defining concepts. And then you start to pull it apart, right? So I think there's maybe some clarity that's still to come to that. I don't know, it'd be interesting to think about, right? Like what, as an anticipatory action community, do we think the local means? And maybe, I mean, that would actually also be interesting. Does it mean anything different for anticipatory action than it might mean in other disaster contexts or kind of climate, natural hazard contexts? But I'll pass it over to others.
Great, thanks, Evan. I think Louis or
I can.
Yeah.
Well, I think there have been a publication referring anticipatory action, even $1 that you spend, you save it X dollars on response, those kind of evidence already. But I want to go beyond that in terms of there have been if you're able to, through anticipatory action, you're saving more lives and livelihoods of communities, of individuals. You could be somehow very happy to see all our efforts have paid off because we managed to save lives and livelihoods. But beyond that, we have to recognize that anticipatory action is a part of an spectrum of humanitarian response or development spectrum somehow. So you may save some from anticipatory action, or you still have a way to go in response to somehow. But for me, a successful anticipatory action program would be something that also is linking different dots of the chain, being able to save development efforts over time, saving lives and livelihoods, but reducing the efforts and resources that are needed for disaster response, and helpfully as someone already mentioned, issues of dignity, of issues of local empowerment over time. The critical issue that we are having is right now, as we are defining anticipatory action, is a window that you have that may vary from a few hours to eventual 3 months for cases of drought. And in that window, if you don't taking that window as a part of a spectrum of intervention, which is bringing back to development efforts that we are linking to anticipatory action, that later will be linked with disaster response and then recover, etc., then you might be missing these dots of linkages. So a successful anticipatory action should be something that's really recognized that this is a part of a broader efforts of development, of resilient development, as later on coming into reconstruction. Sorry, yeah.
Great, thanks, Louis. And yeah, as I was just posting there, unfortunately, there is a couple of questions left. I believe one around working with other institutions like Met officers and local governments. I don't know if maybe you want to post your responses in the chat while I summarize and sort of bring this to a close. And then there was one about allowing or encouraging innovation within the space. So if the panelists are able to respond to that in the chat while I summarize this, and also I think probably we will try and send a response with the link when the link is shared, if there's space for us to do that. So yeah, and I still see questions coming in there, but unfortunately we have to bring this to a close. But I think this has been a really great discussion, and it's always so great to have different perspectives coming into this. I think we've heard a lot about, when we're talking about localized anticipatory action, that is actually not even that clear cut, that it will mean different things for different people. I think there are broad things on which we can agree on, but then within those, we need to be a little bit more nuanced when looking at each individual case, for instance, looking within international organizations and trying to understand how localization happens within those. We had some great examples. Some great questions also around whether this is specific to anticipatory action and humanitarian action, and I think that is true, but I think there is an extent to which there's greater urgency almost within anticipatory action, right, because of this whole question of timeliness and being timely. We've had great examples drawn from Hurricane Idai to COVID to HIV, just to show us, where else we can learn from other sectors. And then there's also the call to really try and differentiate the needs of different groups and not see everyone as sort of having the same needs. So we heard about the challenges of working in the space with refugees and drawing on local actors and local communities to try and understand those needs within on refugees. We also heard about sort of the whole gender aspect as well as the needs of children, how we might want to use that space to incorporate the needs of children. So I think a lot still we need to learn from, and I think this is a great conversation starter. We will continue to monitor this space. I think as I said earlier, the recording will be shared with you all, so you can share it with your networks, or just revisit the discussion for yourself, and maybe we'll try and answer some of the questions that were not answered in the chat. I want to thank you all for joining this conversation today. I know it's probably quite late for some of you, and quite late in the year as well. So great to see such a great turnout. And thanks a lot to the panelists for a really great discussion. You gave us a lot to chew on. And yeah, I wish everyone a happy holiday season and start into the new year. Thank you.